My name is Albert. I work at Kingston Hospital NHS Trust.
Hi, I'm Carmel Oliver. I'm a midwife at Kingston Hospital.
I'm Steve Roots. I'm the Senior Charge Nurse on the Acute Assessment Unit at Kingston Hospital.
Hello, my name's Hayley Burgess. I'm a healthcare assistant.
I'm David Grantham, Director of Workforce and Organisational Development.
Kathy Pullen, I'm the Head of Nursing for Medicine.
My name is Sue Engie. I'm a team leader.
My name is Bill. I'm Senior Charge Nurse in Kingston Emergency Department.
Hi, my name's Jenny Parr. I'm the Director of Nursing and Patient Experience at Kingston Hospital. In the next couple of minutes, myself and the team will be talking to you about some of the things that we've been learning with our experiences with Allocate software version 10. There are a number of stakeholders within the organisation that have a great desire for lots of different benefits out of the system, and so that's been a key aspect of the work that we've been doing with Allocate. I have previous experience of working with Allocate at Imperial Hospital, and that was very good grounding in what the system could do. But coming to Kingston, I was very keen that we tested the market fully and had a fresh look at what was available to ensure that we made the best choice for us and our needs.
We approached the deployment of version 10, which was a new product, with a very strong partnership with Allocate. So we've got a project board that brings us together regularly to monitor progress, and we've been very pleased with the support that we've had. As it's a new product, there's obviously been the odd glitch, sometimes with software. You've got the usual difficulties with any change management program of managing to engage all of the staff at the times you'd like them to attend workshops, but working hard together, we've been able to overcome those obstacles. And the other thing that sort of really has kept the project going is that everybody can see that this is a great product that really is delivering benefits to our staff and our patients.
In terms of the comparison with version 9, what the feedback we are getting is that this is much faster, much better.
What I loved about sort of eRoster was that sort of you could do the roster analysing, so it actually gave you a sort of a direction of sort of how the roster was doing as you were producing it, and at the end of it, it gave you sort of missing skills, links to sort of like whether there was particular areas that are problems, annual leave management, whether there was any particular areas that sort of you either had too many people or not enough people on annual leave. But also the sort of nice little features, having sort of very cloudy sky from poor sort of roster to a really nice blue sky that gave you to sort of saying that actually it was a good roster, which is quite a nice feeling to have when you get that finally.
For the staff, the benefits are that they can access the system online from home, they can review the roster, look to see when they're on days off, also make requests online for specific days off and annual leave, and they can also keep a track of their annual leave, so they're not having to go to the sister to clarify how much annual leave they've still got remaining.
I like the fact that Health Roster V10, I can access it from home by requesting my rest days as well as annual leave, as well as whether I want to do a long day or night. And I also like the fact that I can access it on my phone as well as at work itself.
We've just started using the V10, and what I really like about it is the auto roster part, because it shows you your skill mix. It's really quick and easy. At a glance, you can see what's happening within your ward after the off duties have been made.
What I mainly look for in Health Roster is a system that can quickly show me my staffing and skill mix, especially in a busy area like an emergency department, where I need to flex up and flex down my staff according to needs, and know which staff I have available for various areas, and be able to quickly see that and analyse it so that I can place the staff in the right areas.
Version 10 has come a long way, and it's a great improvement on the version 9 and 9.5.
One of the things I've been particularly passionate about is the system being able to support the realisation of benefits and make that really transparent. Allocate have been very keen to work with the organisation to ensure that we are setting systems and processes in place which give us the great foundations for being able to build on those, understanding where our establishments are and what we might need to be looking at in terms of realising benefits in the future. And we continue to work with them as we go forward with our implementation to see where we can tackle new and more exciting things.
When we've been deploying this, we've been working with our nursing staff about their establishments, and already we've seen that the deployment of the software has influenced the way that their rosters operate. We've worked very closely with Allocate around their benefits realisation model So we've been at the initial stages of that. We're not even fully deployed yet in all areas, but where we have deployed, we've been, as I said, securing those benefits out of the system and been able to track those using the methodology that Allocate have been able to supply us.
What we're seeing is something which for me is a bit unprecedented, which is the users of the system are really enthusiastic about it. They couldn't wait to get the e-rostering version 10 in, and there's a queue of people trying to jump the queue actually in order to get their ward and department onto the system.
In terms of benefits realisation, it's always hard in any project to attribute the cost reductions that you're seeing to individual items of change, but this product has driven change within the organisation, and I know that we've saved £800,000 on our bank and agency nursing bill from last year to this year. Now that's a significant reduction. Not all of it will be attributable solely to Allocate's product, but a good proportion of it will.
And so far we've had it's had a very positive impact on our members of staff.
My longer term vision is that we can link this to the deployment of all our staffing groups, nurses, allied health professionals, doctors, and indeed resources as well, so that we're making sure that, you know, when a patient comes in to be treated, they've got the right person, they've got the right equipment with them, and they're being seen at the right time by the right person, all of which will support quality care for patients.